move with a mirror to the hospital and of course to the ward, because I need to make sure that I'm popping for my patients. Or you might of course forgive me for the things sparkling up and down because they are just aligned down here on the table. So hi honeys, how are you? Tanyanishailoc here, and of course welcome back to my YouTube channel. What's popping, what's well, and of course all that particular kind of good stuff over there. If this is your first time over here, yes, welcome to my channel. I'm tanyanishailoc. I do videos about makeup, glam, fashion, beauty, and of course my medical career kind of vlogs. But of course, as you have seen from the thumbnail and of course the title of the video, today we are going to be diving into my bag. Yes, I want to show you everything of course I carry to my nursing institution, of course to the ward, to the hospital, and of course all that particular kind of stuff. So if you're interested in stuff of that particular kind of caliber, please first of all subscribe, share out the video, comment something in the comment section below, and of course let's just dive into the video right now. Guys, it's a disclaimer. I don't know if it's a disclaimer. If it's not a disclaimer, I usually carry to school a lot of bags, like literally a lot of them. It might be of course in that particular kind of day I'm going to be carrying these full backpack to school, and of course in another day I'm gonna be of course carrying only these simple kind of bags to school. A lot of them. If you have not seen of course yet my bag kind of collection video, I'm gonna be leaving it up here. Please go watch that immediately after this. But of course, as you know that the nursing profession is like any other medical career or any other medical kind of profession. The things that have to be of course on our bums, like on 24/7, especially when you are to attend the ward, or you are to attend the hospital, or you are to attend school. So I'm gonna be of course first of all starting with those essentials, and I hope that I'm gonna try to break down and of course see if I can explain what I use them for, and of course why do I carry them to school. So first things come first, let me first of all start with just start from the sphygmomanometer. No, this is the stethoscope. Let's first of all start with the stethoscope. So literally, you guys, if you are not very kind of relatable or very updated with that, not even updated, but you're not related, if that is right English, with the medical career or the nursing career, we do have to carry stethoscopes, especially when you are going for different shifts. It's not only day shift, but of course also night shift, of course also ward rounds, and of course all that. So this is the first thing that I always put into my backpack. Main importance of the stethoscope is of course it helps us of course during taking blood pressure measurements, and of course also checking on the heartbeats, and is of course one of the things that I don't forget into my backpack or pocket, especially when I'm going for ward rounds, as I've told you. Actually, the next thing is I've been practicing off camera the name of this thing. Imagine that it has taken me years, not years but months, for me of course to be in the nursing school and of course come to learn about these different names of these different instruments. So it is this sphygmomanometer. I don't know if that's the right pronunciation, but I love to call it the BP machine. Yes. So the second item that I do always carry into my bag is this BP machine, or the sphygmomanometer. Literally, guys, the word is confusing my brain, but the BP machine, the main use of this is to take blood pressure, and we are only authorized to tell the measurements to our fellow nurses and of course our fellow medical staff. We are not allowed to tell the patient, or the patient is whatever the case may be. We are just allowed to tell them that your blood pressure is good or bad or needs to be improved. Only that. But we don't teach our patients how these machines do operate. But yes, this is the second machine or second material that I always put into my bag, especially when I'm attending ward round, school, especially for ward placement, night shifts, day shifts, whatever the case may be. So the third item that I always don't forget, especially when I'm going for ward placement, is of course the nurse's scissors. Yes, this is the third item, one of the third item that I always pop into my bag, because I know how important it is, especially when we are dealing, especially I work at the pediatric ward where I deal with infants and of course babies and of course all that, and especially for the last few weeks I did work at the pediatric ward, at the clinicals of the pediatric ward, if that English is right. I was at the pharmacy area where I used to dispense out drugs. So it helps you a lot when you have your own nurses scissors, but they are also of course important in other fields which I'm not authorized to tell you right now at this moment in time. But maybe of course if you want to let me know in the comment section below. I almost forgot this. The next thing that I always do carry in my bag is the nurse's watch. So literally this is the nurse's watch. This is how it looks. It comes in different shades, different colors, and of course all that. I really do love pink, but when I went out to buy this nurse's watch, a little bit of history about this. I was with my mom, and my mom was like, oh my god, white is so cute. Then I was like, mom, no, pink is so wonderful. Then she was like, no, take white. And I don't love always to argue her out. I just love her to be in her own space. That's why of course I accepted it. But pink, girl, it was popping, like popping. That's why of course I just remained this for the sake of my mom. But if it was not for her sake, for God's sake, I wouldn't have remained with it. But the main importance of this, another thing, we do put them on shirts, such as here. I'm going to attach it here for you to see, such as here. And of course, the main importance of these ones, I think you know. Being a good time manager, it's part of the rules and regulations, and of course the qualities of a good nurse. We have to be punctual, and of course all that. And I know a lot of you guys will be in the comment section, why don't you put these watches of course that go at the wrist? So we do put them also, but of course these especially we do a lot of procedures, like we do a lot of procedures, blood transfusion, we talk about bed laying, and of course all that, a lot of procedures, nasogastric tube insertion, and of course all that. And most of the time these jewelries or watches, they might do contaminate our patients, and of course the different procedures. So that's why we love watches that are here. And the most special thing about these watches is that when you flip it like this, it's almost like this watch here. Something that I can never forget in my life is my key holders, and of course my keys to my, not apartment, but my keys to my room, or literally my space where I do sleep. I always don't love people to always be coming in and disorganizing in everything I have over here. And that's why of course I have my key holder, and of course my keys. I don't forget this because it's very important. The day I left them at home, I found a mess, a very full mess, and of course I got annoyed of them for more than 1 week. Yeah, concluding this video, but I want to talk about the beauty bag. No. Before we talk about the beauty bag, let us first of all finish the essentials. You guys, I cannot move out of the house without having a nurse's dictionary. Yes. I don't. If I do move out, just so that I'm going to be using the nurse's dictionary on my phone, because I always do need a dictionary. I'm always that nursing student or that nurse on the board who needs to know everything, like everything. That's why of course I always move with my dictionary. My dictionary is my life. My nurse's dictionary is my life. I do move with this. It has a lot of important things, you guys. I don't know if you understand this. It has a lot of important things, especially in my career, which I do. It expresses everything I need to know. It tells me everything I need to know, how different procedures, and of course different terms, new terms, whatever I want to call it. And it's just a mini dictionary, but of course it's an Oxford kind of dictionary over here. I want to talk about my tablet. Yes, keeping up with the modern kind of reading to school, and of course all that. So this is my older kind of tablet, which I think I did a video with explaining to, just forget that it is dirty on the screen. But this is the older tablet of mine. Of course I was bought two by my dad, and of course half money from my mom in 2016 when I did pass senior 6. Was it? Yeah, when I did pass senior 4, not senior 6 but senior 6. Senior 4, not senior 6. What the hell is boiling in my brain? But when I did pass senior 4, they did buy me this, and it has been very, very important to me, topping on all my work. And of course I have 2 tablets. The normal one that I always do take to school, and of course this always keeps my PDF files, and of course it also keeps my different attachments, work, files, folders, whatever the case may be. And I usually of course love to move with it when I have no notebook or any of that. To my beauty bag. So this is my beauty bag, or is in my backpack. I always have a very mini bag such as this. This carries most of my life, like when I need to get glammed up for my patient who is surviving and healing. I have to be glammed up, you guys. And me, I don't care that if I'm a man. Most of the people have to call me a lot of, but that's okay with me, because at the end of the day, that's me. It's my life, it's my body, it's everything's about me. And Yes, I want to talk about every product that's in here right now. So first product that is, of course, not product, but first item, of course, in my beauty bag is, of course, this mirrors of mine. Yes, I always move with a mirror to school because I always need to check my face, my booty, that I'm on point, and of course I'm popping for my patients. Yes, that I'm popping for my patients. I always move with a mirror to school, or of course to the ward, whatever I want to call it, to the ward, to the hospital, whatever I want to call it. Onto that, I always also move with a beauty sponge or a beauty blender, whatever I want to call it, especially when I'm wearing makeup to school. But most of these days I don't love to wear makeup, especially when I'm going to ward attachments and a school, because at the end of the day you just get so sweaty. And of course my lectures, as I told you that I have most of the time 3 lectures, and so I was talking about makeup. I usually don't wear makeup to school most of these days because I have a very long time frame. I go to school early in the morning at 6. I always come back in the evening at around 6, so I don't have time to take care of my face, you know. I just take a moisturizer, and this is the moisturizer that I always take to school. It is Cushion Baby Lotion. Yes, milled milk. I love this product, you guys. I love this product. It just gives me amazing kind of momentum. Yes, momentum. I love every part of it because it just moisturizes my hand. It makes me pop like a queen, you know. Item that I always move to school with, especially in my beauty bag, it is of course this brow comb. I love this brow comb because it's one of the items that I did buy in my life, especially when I was starting out in makeup. By the way, you guys, when you look critical to my brow, I've not been to the barber for a very long time, or to the brow cut. I don't usually groom my brow one of these days because I realize that whenever I do groom them, I get issues. So I literally want to go to a lady who knows how to groom them so that she can groom them for me. But I always move with this guy over here, especially in the evening when I'm coming back from school. I want to be popping. I want to be, of course, on point, and this is my friend for that particular kind of function. Yeah, this is how it looks. Not the least, I want to talk about my ID. Yes, it's over here. It's over here. I always move also with my ID to school because it's important. This is my national ID. My school is very vague. It has not given me yet. Yes, it's very vague. It has not given me yet my school ID. That's why, of course, I move with this guy because it's important for me to show the coops when I find them that I'm a national, not a national, but I'm a Ugandan citizen. I'm a national citizen, whatever I want to call it. But I do move with this most of the time. And the last thing is this lip gloss. Lip gloss, yes. Last but not the least, this lip gloss. I always move with it to school because the moment in life when you just feel like your lip is so freaking dry, and you just need something, of course, to bring back them to life. But bring them back to life. Yes. So the last but not the least, I want to my water bottle. It is empty right now, but of course it's also part of the things that I do love to move with to school because I love being comfortable with myself, and I love having my own things, my own property, so that I'm comfortable with what I'm drinking, what I'm eating, not sharing cups. Corona is alive and is living. Thank you very much, you guys, for watching my video. That's if you have been watching. It brightens up my whitey life. It brings me to another level. Let me catch you again in my next video. Remember that smartness, elegancy, and of course exploring the magic of the subconscious mind in 2020. Tanyanishailoc switching out. Bye for now.